clinical immersion is definitely something really totally new to me, and it's really exciting at the beginning.
Well, we were prepared that it's going to be early mornings, late nights. We were prepared that it's going to be some sites that you would never like to see with a lot of blood. So since we were prepared, it did not turn out to be very difficult.
So the whole process from the start was very interesting, but I guess it's like trying to understand how the ecosystem works initially, and then your mind is just very alert to observing things because it's a completely new place. So it was a challenge to try to understand how things work, but at the same time asking yourself, why does it have to work that way?
I think you're trying to balance two different aspects of observation. One, which is some of the direct feedback you're getting from the people you're observing. So you hear a lot from the physician or the patient in terms of their challenges and their experience, but you're also trying to read between the lines and kind of see things from your own perspective to try to draw out unique insights that might not really be explicitly mentioned in what they're saying to you.
The hardest part for me was to get up early in the morning because, generally immersion or the clinical observation phase generally starts at 7:30, 6 in the morning. So for me, it was really difficult. And also, I observed like doctors here or physicians use a lot of abbreviations. So for me, it was really difficult to understand their abbreviations, and what I used to do, I used to make a note and will go back and look at internet, what does that stand for.
Just, writing down keywords of what you saw and then looking up later and being like, oh, that's what was going on. Okay, great. And then asking our clinician for help as well.
The hardest part of being an observer was at times staying out of the way. So I was a little nervous that you might step on the wrong cord or trip on one of the machines during a surgery or in the clinic, but that didn't happen, thankfully. The other side was you're really stepping into a space that you're not the expert in, and you're surrounded by the experts. So really pushing yourself to kind of think out of the box and challenge their expertise, because it's very easy to just allow the experts to kind of guide you and tell you what's going on.
The advice I would give is to remember to observe, but at the same time try to find the opportunity to verify what you observe. So if you thought you saw something interesting, the first thing is write it down. But the moment the opportunity comes up, ask the surgeon or ask the doctor or ask the nurse, why was it that way?
Don't be afraid of being judged. Try to ask questions if you don't know.
Come in with an open mind, and just try your best to be really observant and ask a lot of questions. There's some more friendly people that you tend to follow more, and so you just keep asking them why and how they do it, and basically keep an open mind.